we're going to talk about the bones of the skeleton. There happen to be 206 bones in our entire skeleton. So if you were to count every single bone in the skull, every single bone in the rib cage, every single bone in your arm, in your hand, in your legs, in your feet, there would be 206 individual bones. Out of those 206 individual bones, there are two sections of skeletons. One skeleton is known as the axial skeleton. Oops, I'm sorry, guys. This should be presenting. The axial skeleton. The axial skeleton is 80 of those 206 bones. And it includes our skull, so it's the blue bones versus the purple bones. It's our skull. It's our vertebrae of our spinal column, or the vertebral column. And it's the rib cage, otherwise known as the thoracic cage. And if we're in class, I have a big skeleton I usually refer to, but I don't have that skeleton here, so unfortunately, I can't point to it. I'll do the best I can to point to the diagrams up on the screen. Excuse me. The purpose of the axial skeleton is to provide support for the body. It's what holds us upright, and also protection. So think of all of the organs we would find in the thoracic cage: the heart, the lungs, the liver, the spleen, the pancreas, all of them nicely protected in the thoracic cage. All of those organs are vital to our staying healthy and alive. The skull protects the brain. It protects some of the spinal cord, and then the spinal cord continues down the vertebral column, the spinal column, which protects the spinal cord. So we think of the axial skeleton as our support skeleton and our protective skeleton. But then the other 206, or the other part of the 206 bones, which happen to count out to 126 bones, is what we call the appendicular skeleton. The appendicular skeleton. These include the shoulders and arms, the pelvic area, and our legs. And that includes our hands and feet too. You can consider your hands part of your arms. You can consider your feet part of your legs. The purpose of the appendicular skeleton is to help with movement and manipulation. Movement, obviously walking. Manipulation, grabbing, writing, manipulating. So 206 bones in total, 80 bones, the axial skeleton, 126 bones, the appendicular skeleton. You can see the appendicular skeleton in pink, the axial skeleton in blue. Two different purposes and two major parts of the body in terms of the skeleton. That's okay, Abigail. You can always go back and look at the slides from the whiteboard on the homepage to get the notes that we covered. And I'll also be posting this video online too. Try to get to it this afternoon. And so what we're going to do now, we're not going to take any more notes for a few moments. And we're going to probably all getting an alert on your cell phones. Mine just came over. What we're going to do is we're going to look at the different bones, and we're going to look at their names. Some of these bones I'm going to expect you to remember. That's going to be the axial skeleton identification sheet. The other ones you're not going to have to memorize, but I just want you to be aware of what they're called. If we were in class, we would spend a lot more time on this, but since we're in distance learning, we don't have as much time in class. We don't have as much time to really memorize these bones. So this is more just information about the bones, what we name them, where they are, and then what they do. So let's start up at the top here. We have the skull. This houses our brain. The skull is made of lots of smaller bones that are held together by cartilage, which we'll talk about in a few slides from here. The skull, if you go down a little bit further, is attached to the body via the vertebral column or the spinal column. These are individual bones, which we call vertebrae. And each one of these individual bones are attached to muscles that allow movement of our body. Side to side, forward and back. It allows the neck to go this way, that way, this way, that way. If our spine was fused, one big bone, we would not be able to move our neck or even abdomen. We'd have to literally move our legs in order to look from side to side. Some people actually get injuries to their vertebrae where they need to have them fused, and people who have those spinal cord, pieces of the spinal cord fused, lose movement. They lose their ability, range of motion, we call it. If you break a vertebrae, you need to go to the doctor to have it repaired. A broken vertebrae can expose the very precious spinal cord underneath, which carries all of the nerves from the brain to the body and from the body back to the brain. So not only does the spinal cord protect, the vertebrae of the spinal column, not only does it protect the spinal cord, but it also helps with the movement left to right, forward and back. So if you broke one of those vertebrae, you would have a hard time moving in whatever direction that vertebrae was responsible for helping move. You have to remember, our muscles are doing the movement, but the muscles pull on bones in order for that movement to become motion. Without the bones, our muscles would have nothing to pull against, so we wouldn't have a movement of an arm like this, or a leg, or walking motion, or twisting, or bending. Going down the shoulder, very top here, this is known as the clavicle. The clavicle can be seen from the top. It's this bone right here. You can feel it on the top of your shoulder. It runs from the neck over to your shoulder. And then in the back, you have the scapula. It's a flat bone, and it holds onto the clavicle right above it, and it also holds onto the humerus, which is the bone of your upper arm here. So let me go down the arm. This big, large bone of your arm is called the humerus. That connects to two bones of your forearm called the ulna. The ulna is the big bone of your arm, and then the radius is the smaller bone of your arm that allows your hand to make this movement back and forth. Without the radial, we would have a hand fixed in place, and we wouldn't be able to twist back and forth. Again, it would be a lot easier to see this on a skeleton in front of you. You would get exactly what I'm saying. The bones of that wrist are known as the carpal bones. You can see they're really tiny bones. They attach to the bones of your hand, which are known as the metacarpal bones. And then the bones of your fingers You have individual bones in your fingers known as phalanges. Phalanges. You have 3 phalanges for each finger, 2 phalanges for your thumb. Then back to the body. We have this huge thoracic cage, which stores our heart, our lungs, liver, pancreas, spleen. It attaches in the back, held together by cartilage on each little process. We call this the transverse process of the spine. It doesn't quite touch, but it's held together with some cartilage. So the cartilage is a little flexible. Goes all the way to the front, where it attaches with yet again more cartilage to this center bone called the sternum. The sternum is made of 3 smaller bones, which we'll talk about in a moment. And then, so you see the rib cage is flexible. These bones are attached to a hard cartilage. It's much softer than bone. It allows your rib cage to expand and contract. Expand and contract so we can breathe. The vertebrae in the spinal column have cartilage in between, which we call discs, and they actually separate the bodies of the vertebrae, which we'll see in a moment. That's the big bony part of the vertebrae. Basically holds our weight in an upright position. Going down the vertebrae, which we'll talk about each section of the vertebrae in a second, it's connected to this bottom part of our spinal column, which we call the sacrum. And then the coccyx is the little protrusion in the bottom of our spinal column where we used to have a tail. Now, we humans lost the tail a long time ago. Our ancestors had a tail back when we were still hanging out in trees. And this is the coccyx used to extend much longer, and there used to be multiple bones coming out here, just like the bones of a dog or cat or a monkey. This bone on the side of the pelvis is known as the coxal bone. It is larger in women, smaller in men. It connects to, this is the thigh right here, it connects to this large leg bone. This is your thigh. We call it the femur. This is the biggest bone of your body. Does anybody know where the smallest bone of your body is? Yeah, good job, Scarlett. Kim, yeah, you meant to say ear, right? Gloria and Kim. Yeah, the ear. So one of the smallest bones in our body is actually in our ear, which I'll show you an image in a few moments. Good job, Daniel. The biggest bone in our body is right here. It's the femur. And it's a large bone. It's a long bone. It's one of the biggest of the long bones. And it attaches to the shin bone, which is the tibia. There's a kneecap bone right in front, which we call the kneecap, patella. And then the small bone of the shin is known as the fibula. Again, the fibula acts just like the radius, and it allows our foot to go left to right, to twist. It allows that twisting motion off of the femur. So between the tibia and the fibula, and you can actually feel the tibia if you just take your shin, put your finger right on your shin, you can feel the side of the tibia right there. It's a pretty big, long bone. That continues down to the foot. These small little bones in the foot, very much like the small bones in the hand, where we call these the carpal bones. These are called the tarsal bones. So carpal bones are the small bones of the hand, usually found right here. The tarsal bones are the bones of our feet, which are found right here. Then the metatarsal bones, they extend down to our toes. And then the bones of the toes are called phalanges, just like the bones of the fingers are called phalanges. And now the thoracic cage is broken down into more bones. The vertebrae are identified as separate bones, so we'll talk about each of those. But first, we're going to look at the skull. because the skull is broken down into many bones. Now, don't worry about all the words on this list. You don't have to remember all of these, and in fact, a lot of these words have to do with parts of the bone. So let me show you the major bones I want you to be aware of. First, your forehead bone is known as a frontal bone, and you'll see that it's not one continuous bone in the skull. It's small pieces that are held together by cartilage. The frontal bone is your forehead and top of your eye sockets. The side, your cheekbones here, are known as the zygomatic bone. Lacrimal bone, little bone behind the eye here. Bone right here where my glasses are sitting is the nasal bones. There's two of them. If you've ever had your nose broken before, you actually didn't break any bones in your nose. You broke the cartilage that happens to come out here. It's very rare for you to break these frontal bones here, but it can be done if you get hit hard enough right here, right on the bridge of your nose. These bones can actually break quite easily, and this is really dangerous. If somebody hits you really hard in the face and they break either this part of the frontal bone or break this part of the zygomatic bone, it can fracture and it can blind you. And so one of the dangers of getting in a fight is actually losing your vision, and it's not as uncommon as you would think. There are a lot of bones, you're right. And so if you realize that you have a broken bone in your eye, let's say somebody hit you really hard or something hit you really hard, get to the doctor right away. Don't let that thing heal on its own, because that bone could actually puncture your eye if you're not careful. The side of our heads are known as the temporal bones. Yeah, so Kim, good question. So the part of the nose that fills in right here, that actually causes the outward motion of our nose, like this part, I have a big nose. This part is cartilage. If you take your nose and you bend it back and forth, you can see it's not hard. It's tough cartilage, but it can be bent. So if you ever get hit in the nose really hard, you're actually just breaking the cartilage. And it does need to be set in its proper spot. That's why they put the cast on your nose. But it's not actually bone that's healing most of the time. Sometimes you can break the nasal bone, but it's rare. Now the bone here that holds the top teeth is known as the maxillary bone. Your lower jaw that has the ability to go up and down when you talk and when you eat is known as your mandible, and it holds your lower teeth. And it actually holds onto the temporal bone and the I'm drawing a blank here. The temporal bone and the lacrimal bone via ligaments holds onto the mandible, so your lower jaw doesn't fall down. Then going to the back. So this now we've taken off the mandible from this skull, and now we're looking right underneath the skull with no mandible. The back of the head is known as the occipital bone. Here's the sides, the temporal bones. And then there's this big opening in the occipital bone that I want you guys to be aware of. It's called the foramen magnum. Foramen, when we're talking about bones, is a hole, an opening. Magnum means big. So the big hole in your skull is in the occipital bone. Any ideas what comes out of that bone? Why do we need a foramen magnum in our skull? What organ would come through there? Kim says the spine. Exactly. That's where your spinal column attaches. That's where your spinal cord comes out of your skull. Your brain would be found in there. The spinal cord would come out. So you need an opening for that, right? Let's go to the side. So here's the frontal bone. Here's your forehead. Here's the zygomatic bone, your cheekbone. Here's your maxillary bone. Here's your mandible. Here's the side, the temporal bone. This is where we have your ear canal. This is where your ear goes inside your head. This is the back occipital bone. But then there's this large bone on the back of your head known as the parietal bone. And now these bones are not attached to each other via bone. There's cartilage in between. Very tough cartilage. It doesn't move all that much, but it's cartilage. So there's a little give to the skull. And we call these openings sutures. And now the reason the skull is not one large bone, especially this area here, the reason we have these sutures is because of how we are born. When we are born, we come out of our mother's vagina, and our head is too big for that. If we were to, even as a newborn, the head is too big. So what nature has done is it's created a skull that's attached via cartilage that has the ability to squish. And so you may see a newborn with kind of like a little bit of a cone-shaped head. What happens is those sutures actually allow the skull to squeeze down to a smaller size so that birthing doesn't kill the mother. If we came out with a fully closed skull, moms wouldn't make it through birthing process. It would be too much to get through that vaginal birth canal. And luckily, we've evolved a skull that can kind of bend out of shape a little bit. Now, when you get to a certain point, those sutures close, and they don't move all that much. But when you're a small child, as I'll show you, I think it's in the next slide or a few slides forward. Let me double check. I always forget the order of my slides. Yeah, we'll get to that. Yeah, we'll talk about that in just a sec, Kim. They do fuse at some point, but they don't completely fuse in the skull. So here's a section of a skull. We've taken a transverse section. Remember, transverse is this way. Taking a transverse section of the skull, we've opened up the top and the bottom. You can see the foramen and magnum right here. You can see the bottom temporal bone. You can see the bottom occipital bone. You can see the frontal bone here. And so the brain would sit right on top of this section right here. This is a mid-sagittal section of that skull, so now we can see it from the side. The brain would rest right inside of the skull there. Here's the occipital bone. Here's the parietal bone. Here's the frontal bone. And you can see it's pretty much compact bone with a little bit of spongy bone in the center. This is flat bone. Remember, there were different types of bone we talked about? This we call the sinus cavities, its opening. You can see the maxillary bone is the roof of your mouth, basically. So if you take your tongue and rub it against the roof of your mouth, you're actually touching your maxillary bone with some tissue on top of it. Holds the top of your teeth. And let's see. This is your spinal column. Now the spinal column is broken up based on curves and based on where that spine is found in the body. If we're looking at the spine towards the top of the body, these vertebrae are much smaller than the vertebrae underneath. Do you guys see the different size in the vertebrae here? Each one of these vertebrae are slightly different, and so we name them from top to bottom. The top vertebrae are known as the cervical vertebrae, and the very top vertebrae of the cervical is named C1. The one underneath it, C2, all the way to C7. And then we section off right at the height of the shoulders the thoracic vertebrae. The thoracic vertebrae bend towards the back, so it creates this space for your lungs and your heart. And then again, we start counting with a number 1, T1, T2, T3, all the way down to T12. And then where your back starts to curve in again, we call that the lumbar region or the lumbar vertebrae. So cervical bends forward, thoracic bends back, lumbar bends forward, and then the sacral region is a few vertebrae at the very bottom of your spine. And again, the lumbar is named number 1 at the top, number 5 at the bottom. And then there's only a couple bones here in the sacrum, so sometimes we don't even name them. Some people do, but we're not going to worry about that. Now, each one of these vertebrae have a different size to them and a little bit of a different shape. Each one of these vertebrae are responsible for different types of movement. Your cervical vertebrae help you go left to right, forward, and back in motion. Remember, there's muscles attached to all of these vertebrae, pulling and pulling and pulling in order for that type of movement. Your thoracic vertebrae have the ability to go this way and that way. A little bit that way, a little bit that way, but mostly up to the left, up to the right. The lumbar is much better at allowing you to twist your body to one side and twist your body to the other side, whereas the sacral really just holds on to the lower portion of your body, your pelvis. The different vertebrae look different depending on where you find them in the spine. Cervical vertebrae look much smaller than lumbar vertebrae. Think about this. Cervical vertebrae just have to take the weight of the vertebrae above them and the head, which the head is pretty heavy in its own right. But as you go down further, the thoracic vertebrae need to be a little bit bigger because now they're holding up more weight than the vertebrae at the top. Then when you get down to the lumbar region, these vertebrae are much larger. They have a much bigger body. They have much bigger processes to grab onto muscles than the cervical vertebrae. This is a lumbar vertebrae, and these are the different parts. The opening of the vertebrae is a foramen. Anytime you see an opening or a hole in a bone, we call it a foramen. And since this is a vertebrae, we call it the vertebral foramen. The spinous process is the part of the spine that you can actually feel if you rub your hand on top of your spinal cord. So if you rub your hand up and down your back where your spine is, you can feel the little bone that protrudes. Those are the spinous processes of the vertebrae. The transverse processes go off to the side. They're transverse, and they actually hold on to muscles along with the spinous process. In between these two bony outgrowths, which when we have a bony outgrowth, we call it a process, the muscles pull either forward, backwards, left, right on the vertebrae themselves. And that's actually how we have all this range of motion in our body. Don't worry about the superior articular facets or the superior articular process. All I want you to really worry about are the transverse processes, the spinous process, the vertebral foramen, and then the body, which is the large part of bone. Now, there's two very important cervical vertebrae for the movement of our head. Now, the cervical vertebrae, for the most part, just allow us to go forward and back, left, right with our head. In order to get this movement and this movement, it requires two very specialized vertebrae. C1, which we call the atlas, it's the very top cervical vertebrae of our spinal column, sits on top of the C2, which we call the axis. And it allows for this left to right twisting. So when I turn my head this way, I'm pulling on my atlas to spin on top of the axis. When I pull my head this way, I'm pulling muscles to pull my C1 atlas on top of the C2 axis. And the way this works is kind of interesting. There's a ligament that runs around this bony process of the axis, and it attaches to the C1 atlas here and the C1 atlas here, so that this doesn't fly off or this doesn't slide forward or slide back, but it allows motion, twisting motion to the left and twisting motion to the right. A ligament is just dense connective tissue that connects bone to another bone or another piece of bone. Now, the reason I'm doing so much talking and you guys aren't taking a lot of notes is because I've trimmed down these notes so we can get through them today. And of course, if you don't take notes, if you're not writing something down, I don't expect you to remember it, okay, for a test. I do expect you to listen, pay attention, but it's not something that you particularly have to memorize. This is more just for information purposes. Now, this thoracic cage, the rib cage, is broken up into a few different parts. The top ribs, 1 through 7, 1, 2, 3, 4, 5, 6, 7. So 1, 2, 3, 4, 5, 6, 7 are known as the true ribs. Ribs 8 through 12 are known as false ribs. Don't ask me why they name them that way. I have no idea. And then the ribs at the very bottom that do not attach to the sternum here are known as floating ribs. They're floating in terms of they're not attached to this cartilage. This cartilage attached this end of the bone to this bone. This bone right here is known as your sternum, your chest bone. It's broken up into 3 parts: the manubrium at the very top, the body in the middle, and then the xiphoid process at the very bottom. Again, process is an outgrowth of bone. The xiphoid process is actually covered in cartilage, and then you can see all of the cartilage connecting the sternum to ribs 1 through 12. If we had some more time, I'd quiz you on this stuff, but we do not. So the next thing we're going to talk about are joints, and this is where I'll talk a little bit about the baby's skull and how that's a little bit different than an adult skull. But first, I'd like you to write down some notes. So anywhere we have one bone connected to another bone, we call it an articulation, otherwise known as a joint. So we have an articulation between this bone of the phalanges and this bone of the phalanges. We have articulations between the radius and the humerus. We have articulations between the humerus and the scapula, the humerus and the clavicle. We have articulations between the bones of the skull. We have articulations between every single bone in our body and at least one other bone. So it's a place where 2 bones meet. Now we're back to writing down notes. And there's 3 major types of articulations or joints. The first type is known as a fibrous joint. In a fibrous joint, we have little or no movement between the 2 bones. And an example of a fibrous joint would be found in the skull. In between the frontal bone and the temporal bone, there's an articulation, a joint. And that joint is made of fibrous cartilage. Fibrous cartilage is incredibly tough. It doesn't really give all that much. It's slightly flexible, but not really much. And so when you're an adult, your bones of the skull are held together by these fibrous joints. And the fibrous joints hold the skull bones in place, so there's not much movement. But when you're an infant, up to about the age of 2, these sutures are much larger. And there's a lot more of this fibrous tissue than there is when you're older. So it creates a little bit more flexibility. We called the sutures of an infant fontanelles. When you're over 2 years old, they become sutures, but when you're an infant, they're known as fontanelles. And they look very different than an adult's skull sutures. So this would be a skull from an adult. You can see number 1 pointing to the sutures, the fibrous joints between the frontal bone and the parietal bone and the temporal bone, both parts of the parietal bone. But now, an infant has much, much larger sutures, so we call them fontanelles. And this is fibrous cartilage. It's dense connective tissue, tough dense connective tissue, but having a lot more of it makes it much more flexible. And so if you've ever touched the head of an infant before, you have to be really careful because their heads are soft. And if you push on the top of their heads, you can actually push their skulls in, and you can do damage to their brain if you're not careful. Now again, the reason we evolved this advantage is so that mothers can give birth to an animal that has an incredibly large skull. We have a really big head for the type of animal we are. Much bigger, proportionally speaking, than our body, and it's much bigger than it should be. That allowed us to have a much bigger brain. That bigger brain probably allowed us to use tools much better so that we could develop civilizations and society, build industry. It's obviously just a theory, but hypothetically speaking, a bigger brain, the more critically thinking that animal is, the more able to advance. So this advantage right here, having infant skulls flexible, allowed us not to go extinct. If we had skulls that were completely fused, mothers would die every time they gave birth, unless they evolved some type of advantage to be able to give birth to a bigger head. But they don't, and they haven't, because this was what the solution to the problem was. But at about age 2, that fuses into this. And then your skull, it's nice and solid at that point. It's not completely solid, but it's much more solid than the baby's skull. There are other ways that bones are held together, like these bones of the shin. The tibia and then the fibula are held together by a ligament, a joint. Literally holds those bones right next to each other so they don't fall apart. We call these types of articulations cartilaginous joints. We find cartilaginous joints in between the bones of our shin. We find cartilaginous joints in between the bones of our pelvis, here in the pelvic girdle. Remember we talked about the pelvic girdle? This cartilaginous joint allows the 2 bones to open up a little bit during childbirth so that women, again, can give birth to an animal, a baby with a large head, with a bigger brain. Without this pelvic girdle and the fontanelles, mothers would have a really difficult time giving birth. The cartilaginous joints are also found between vertebrae. You can see the cartilage right here. These we call discs. Sometimes when people have back problems, these discs, they break, they rupture. And somebody has to go in and surgically either replace the disc with something synthetic or try to fix it surgically. The sternum is held to the rib cage via cartilaginous joints. It allows for some movement, but limited movement. So the expanding of the rib cage and the contraction of the rib cage. The expanding of the pelvis during childbirth and then the contraction of the pelvis during childbirth. The movement of our spine when we go to the left, movement of the spine when we go to the right. When we move forward, back. So the strongest, tightest types of joints are known as the fibrous joints. The ones that provide a little bit more movement are the cartilaginous joints. But then fibrous joints and cartilaginous joints do not provide enough flexibility for some movement like this. In order for us to really walk around or even dance, play a sport, we need a joint that allows for more movement and frequent movement. And so this brought about the need for a third type of joint, which we call the synovial joint. Now, the synovial joint is a freely movable joint. Think of your forearm and you connected to the humerus here. In order to have this type of movement, you need bones held together in a way that allows them to freely move and freely move over and over again without doing any damage to those bones. Fibrous joints and cartilaginous joints hold the bones together much too tough. We'd never have an arm that could move like this without synovial joints. Same thing with your leg and your knee. Same thing with your wrists, your fingers, your hips, your ankles. These are all synovial joints. And they're made of a very complex system of articulation. So let's talk about the parts of the synovial joint. First, there's cartilage. Cartilage reduces friction. It also provides a real tough material for bone on bone. We saw cartilage when we looked at long bones. Articular cartilage is on each end of those bones. Provides a little bit of a smooth, frictionless surface for this bone against that bone when it moves. Also provides some protection of the end of that bone and the end of that bone when they're moving against each other. So that's our articular cartilage. In the knee, we have an extra layer of cartilage, which we call the meniscus. I'll talk about in a few moments. And then surrounding that joint, we have a capsule. I'll call it the joint capsule. This forms a cavity around that joint, around the two ends of the bone. This allows for some fluid to form inside this joint, which creates a nice frictionless surface, or almost frictionless surface, for the two bones to move against each other. So it provides a little space with fluid in between the bones. Inside that joint capsule, there's a layer of tissue we call the synovial membrane. It lines the joint capsule. So here's the joint capsule. And the joint capsule is actually just an extension of periosteum from that long bone. Remember, there's an outer covering of that long bone we call periosteum, and it just extends all the way down to the next long bone. And it provides basically a bag around that joint. And inside that bag, we have fluid that's constantly produced in the synovial membrane. And so your body, via the synovial membrane, are producing liquids that are constantly going into that joint. And those liquids provide a nice smooth surface, a nice smooth separation between that bone and that bone. And so you can have weight-bearing joints that can move over and over again, like knees, like hips, like elbows, like shoulders. And as long as they're healthy, you can keep doing that type of movement over and over again, as long as the muscles are moving it. And so here's a synovial joint, opened up. This is actually a knee. I know it's a knee because there's extra cartilage right here called the meniscus. Here's the femur. Here's the articular cartilage of that femur. Here's the tibia. Here's the fibula. Remember, this is the shin bone. These two bones are held together by ligaments, literally holding that bone on top of the other bone so it doesn't slide to the side or slide back or slide forward. And then it's covered by a joint capsule, that provides just this watery space in between, with the help of the meniscus, which provides a little bit more padding and a little bit more of a smooth surface for both of these bones. This is the kneecap, the patella. It's held together by a ligament to the tibia and then a tendon to the muscles of your thigh, the quadriceps. A tendon attaches bone to muscle. A ligament attaches bone to bone. They're basically the same thing, though. So here's a joint capsule out of a human arm. This is an elbow with the skin removed, with the muscle removed. Here is the capsule, the extended periosteum. You can actually see some of the muscle still attached. Kind of gross. Here's the radius. The humerus is up here, and you can see a capsule surrounding the ends of those bones. Here's a hip. Here's the pelvis. Here's the muscles. Here's the periosteum continued all the way down to the femur. And this is where our synovial joint is. And inside there's synovial fluid. There's liquid that protects this bone and that bone from moving against each other. So, the joint cavity, continuing our notes in synovial joints, is filled with synovial fluid. So again, here's our bones, here's the articular cartilage, here's the joint capsule, here's the synovial membrane, here's the joint cavity. Ligaments connect the bone to other bone. Guys, I'm just going to keep going with the notes here so that I can post the video. I know I'm not giving you much time for that worksheet. Just try to get to it on your own time. You have till Friday, so don't stress. Just try not to stress. And there's these little sacs that we find in between these joints called bursa. And the bursa actually provide another mechanism for reducing friction. The bursa, which I'll show you in just a moment, are these little sacs found in the joint that basically keep the ligaments from rubbing on top of your bones. And they're filled with fluid, so they can be, squeezed and manipulated, and sometimes they even swell. And when they swell, you get these big bumps, and they ache, but they may not necessarily be painful, and we call that bursitis. So here's our synovial joint again. Here is our femur. Here's the tibia. Here's the fibula. Here's a shoulder. Same idea. Here's the humerus. Here's the clavicle. Here's the scapula. Here's all of the ligaments that hold this bone to this bone and this bone to that bone. But inside these ligaments, we find these little sacs of fluid. And remember, this whole thing is going to be covered in a joint capsule. But inside that joint capsule, there's these smaller sacs, which we call bursa. And they keep the ligaments from rubbing up against each other when you move around. And in fact, as you move the bones around, the bursa actually rotate against the bone and the ligament to give, again, another frictionless surface or minimal friction for this moving bone against the ligament. Because this ligament, if it was left to rub up against that bone over time, that bone would rub that ligament into pieces. It would tear it apart. So this bursa sac protects that ligament, which is holding the bones together, so that this bone can now move freely. Even though there's fluid in there, even though there's synovial fluid in this joint, this bursa keeps the ligament away from the bone. So they're really important. They do, however, swell every once in a while. This is the elbow, and this is a bursa sac that is swelled up. It's inflamed. Maybe it was overused. Maybe that person hit their elbow really hard on something, and it went into inflammation. Sometimes you go into the doctor, they pull some fluid out of the bursa sac with a syringe, and it heals, goes back to normal. Sometimes it'll go back to normal on its own. Call this bursitis. Here's the bursa underneath your kneecap. You can see this is the femur. It's pushing that patella, the kneecap, away from the femur. So this kneecap doesn't grind on the femur. And in fact, if you stand up and you push the bottom of your kneecap, you can feel the bursa sac giving way a little bit. This is a human knee. There's one more slide I want you guys to take notes on, and then that will get you perfectly to the point of my 5th period class. So this is a knee joint. You can see the femur. You can see the articular cartilage. You can see the ligaments holding the fibula to the femur. Here's the tibia. Here's the patella. And then the last thing we're going to talk about, and we'll actually talk a little bit about this the next time we see each other, is the different types of movement that these synovial joints provide for us. So what I would like you to do is please copy these notes down before you leave, and we'll talk about them as a class tomorrow, because we're going to see each other Wednesday. We're going to finish up these notes tomorrow and give you a little bit of time to prepare for your exam. So there's 6 different types of synovial joints. The first type is a gliding joint. The gliding joint allows front, back, left, right movement. There is a saddle joint. Think of somebody sitting on a saddle. There's a hinge joint, which is almost like a door swinging on a hinge. There are pivot joints. This is simply our atlas and our axis. Just give me one sec, guys. I know the time. I see the time. There's ball and socket joints, which we find our shoulders and our hips. These are the joints that allow movement in a circular motion like this. And then there's the ellipsoidal joint, which we only find these in our fingers, our knuckles, our toes, and our metatarsals. these allow for movement back and forth like this with our fingers.